Retinitis pigmentosa, or RP, is a group of inherited retinal degenerations causing progressive vision loss, often leading to blindness. Typically, it affects the rods first, leading to night blindness and tunnel vision. The history of RP dates back to the mid-19th century when it was first described. Later on, the genetic underpinnings of the disease were discovered. Over 80 different genes are implicated in RP, reflecting a complex genetic inheritance pattern. The physiology and pathophysiology of retinitis pigmentosa involve several key changes. Physiologically, there is a progressive degeneration of photoreceptors, both rods and cones, due to genetic mutations, leading to retinal atrophy and pigmentary changes. Pathophysiologically, oxidative stress and inflammation play roles in accelerating retinal cell apoptosis. Microvascular changes and decreased blood flow contribute to the progression of RP by reducing the essential supply of nutrients and oxygen to the retina. Additionally, a lack of trophic support and neuroinflammation exacerbate neurodegeneration within the retina. Acupuncture's role in retinitis pigmentosa management is quite fascinating. The mechanisms of action in acupuncture include modulating inflammation, improving blood flow, and promoting neuroprotective effects. Neurotransmitter and neuropeptide modulation have been shown to support retinal health and may reduce oxidative stress. Physiological pathways affected by acupuncture include inflammation modulation, blood circulation, and microcirculation, and neurotransmitter and nervous system stimulation. Research indicates that acupuncture reduces pro-inflammatory cytokines such as TNF-alpha and IL-6, which contribute to neuroinflammation in retinal diseases. Studies reveal that acupuncture can improve microcirculation by inducing vasodilation and enhancing local blood flow, which is critical for retinal health where blood supply is compromised. Acupuncture has also shown effects on the central nervous system and can stimulate the optic nerve pathway, potentially aiding in visual processing and reducing photoreceptor cell loss. Electroacupuncture and microcurrent stimulation. Electroacupuncture, or EA, uses low-level electrical currents to enhance acupuncture's effects. It aims to further stimulate nerves, improve retinal blood flow, and offer neuroprotection. The microcurrent provided by EA is thought to trigger cellular regeneration and reduce apoptosis by promoting cellular ATP production, which is crucial for the health of photoreceptors and retinal ganglion cells. Microcurrent stimulation can also enhance microcirculation around the retina, promoting nutrient and oxygen delivery to retinal cells. Studies suggest that EA stimulation may prevent retinal cell apoptosis, preserving visual function longer than traditional therapies. Scientific research on acupuncture and retinitis pigmentosa. A 2017 study demonstrated that acupuncture improved visual field and retinal sensitivity in patients with RP. This improvement was attributed to enhanced blood flow and modulation of neural activity. Animal studies also show reduced retinal degeneration markers following acupuncture, supporting its use for neuroprotection and inflammation reduction. Chinese herbal medicine and retinitis pigmentosa. Herbal formulations in traditional Chinese medicine, or TCM, aim to improve blood circulation, reduce inflammation, and protect retinal cells. Ginkgo biloba is known for improving retinal blood flow and providing antioxidant protection. Studies show its use is correlated with improved visual function in RP patients. Lycium barbarum, commonly known as goji berry, contains neuroprotective and antioxidant properties that help mitigate oxidative stress and inflammation in retinal cells, potentially slowing RP progression. Rehmannia root, traditionally used in TCM for nourishing kidney yin, may provide neuroprotection and promote microcirculation in the retina. A 2019 randomized controlled trial found that herbal formulations, including ginkgo and goji berry, improved visual field and reduced oxidative stress markers in RP patients. Studies show that the herbs used in RP treatment act by reducing neuroinflammation, promoting circulation, and exerting antioxidant effects, which are beneficial in retinal preservation. Significant study on acupuncture and retinitis pigmentosa by NIH and Andy Rosenfarb. The National Institutes of Health, or NIH, funded a pioneering study conducted by Dr. Andy Rosenfarb, a licensed acupuncturist and Chinese medicine practitioner renowned for his work in ophthalmology and acupuncture. His research explores acupuncture's effects on vision function in retinitis pigmentosa patients. This clinical trial employed a protocol using acupuncture points believed to stimulate retinal blood flow and support neural health. Electroacupuncture was also applied to enhance therapeutic effects, particularly focusing on microcirculation and cellular rejuvenation in retinal tissues. Dr. Rosenfarb's study demonstrated statistically significant improvements in vision metrics among participants. Many patients exhibited an increase in peripheral vision after a course of acupuncture treatments. Acupuncture was associated with improved retinal sensitivity, suggesting enhanced photoreceptor function. Patients also reported subjective improvements in vision-related quality of life, with effects persisting for several months post-treatment. The study's outcomes support acupuncture's potential as a non-invasive complementary therapy for RP. By targeting inflammatory and circulatory processes in the retina, acupuncture may help slow RP's progression and support remaining vision. This research underscores the importance of further trials to refine acupuncture protocols and confirm their long-term benefits for RP patients. Despite what many Western specialists say about retinitis pigmentosa, RP, being untreatable, there is real hope. At Makari Wellness, we've witnessed significant improvements in people with RP through our specialized ophthalmological acupuncture and Chinese herbal medicine treatments. Michael Woodworth, with 20 years of clinical experience and a focus on neuro-ophthalmological conditions for the last 6 years, has helped many patients slow, halt, and even reverse their vision loss. Michael Woodworth began studying under Dr. Rosenfarb and has traveled across the United States and outside of the country to train with him and the use of micro-48 acupuncture for eye conditions. You owe it to yourself to explore this possibility. There is hope for your vision health.